I welcome you back for another presentation. We're going to look at the ICH guide for stability testing. ICH guidelines for stability testing. So without wasting time, I want to invite, with one purpose, our next presenter. You're welcome.
Good morning, my lecturer. Good morning, everybody. I am an undergraduate pharmacist, Ezekiel Kikelomo Morenike. So I'll be talking on the topic which is ICH guideline for stability testing. We already know ICH is an international conference on harmonization, and we already know that stability is the process of achieving a fair, steady, and a stable state for our drugs to prevent them from risk factors and physical or any external forces. ICH is a short term for International Conference on Harmonization of Technical Requirements for Registration of Pharmaceuticals for Human Use. It is unique in bringing together the regulatory authorities and pharmaceutical industries of Europe, Japan, US, and other countries to discuss scientific and technical aspects of drug registration. This ICH testing is deal with um, is an important aspect of production of drug where we achieve a good potency, effectiveness, and intervals of the drug before use. The objective of ICH are to increase international harmonization of technical requirements to ensure safe, effective, high quality medicine development. I've explained that previously that the purpose for this ICH is to give effective, a safe and high quality drug for the consumers. To harmonize technical requirements for registration or marketing approval, to promote public health, to prevent unnecessary duplication of clinical trials. So this ICH, who are the members involved in this ICH guideline? ICH is comprised of representation from 6 parties within the regulatory bodies and research-based industry in European Union, Japan, and the USA. That are the core regulatory bodies of ICH stability testing: the European, the Japan, and the USA. In Japan, the members are the Ministry of Health, Labour and Welfare, and Pharmaceutical Manufacturer Association. In Europe, the members are European Union and the European Federation of Pharmaceutical Industry Association. In the USA, the members are Food and Drug Administration and Pharmaceutical Research and Manufacturers. Additional members observed from World Health Organization, European Free Trade Association, and from Canada. My colleagues have previously talked about the history of ICH, which is no longer new to us. So now I would like to move to the guidelines of ICH. The first guideline of ICH is quality. These are quality guidelines, harmonization achievement in the quality with new codification revision to an ICH guideline. The quality of our product is very, very important, even aside from pharmaceuticals, even in the clothes you put on or the hair we make. The quality is a very, very important aspect in any of the drug pharmaceuticals that is being manufactured. You have the safety. The safety is very, very important. The right place at the right time to the right consumer. If the drug are not safe, then we won't be able to achieve any therapeutic effect. Whatever we are using the drug for won't come out nice. We also have the efficacy. Is another guidelines for ICH. The efficacy is very important, which helps to design, to conduct, and to report a clinical trial. It also covers novel types of medicine derived from biotechnological processes and the use of pharmacogenetics. And the last here is multidisciplinary guideline at the course which do not fit uniquely into one of the quality, safety, and efficacy category. It includes the ICH medical terminology, the common technology document, and the development electronic standard for the transfer of regulatory bodies. So now I'll be talking about the ICH guideline for stability testing itself, which is the main topic you are diving into. Generally, information on stability of drug substance is an integral part of the systemic approach to stability evaluation. So one of it is stress testing. Stress testing of drug substance can be help to identify the degradation products, which can in turn help establish the degradation pathway and intrinsic stability of molecules and validate the stability indicating power of the analytical procedure used. The nature of stress testing will depend on the individual drug substance. We already know that the purpose of this stability is for us to achieve good efficacy, potency, and to have a longer shelf life. That's the purpose of this stability testing from ICH, from the regulatory bodies. So the stress testing is very, very important if the drug you are producing, if it's able to withstand stress. That's when I talk about the transportation of the drug from one place to another. You should be able to withstand stress, not that you have not taken the drug and the drug is already getting pieces to some particles. So you should be able to withstand stress testing. Also, selection of batches. Data from stability studies on at least 3 primary batches of drug substance, which is the API, should normally be provided. That's the important aspect of the production. That's the API, that's the active pharmaceutical um, ingredient should normally be provided. The batches should be manufactured to a minimum of pilot scale by the same synthesis routes as production batches, and using a method to manufacture and stimulate the final process to be used for the production of batches. The overall quality of the batches of drug placed on stability studies should be representative of the quality of the materials to be made on a production scale. For existing active substance, they are known to be stable. Data from at least 2 primary batches should be provided. What they're telling us here in this selection of batches is how to have the production of drug in batches and how to scale them up so that it can give the required dose that is needed for that particular pharmaceutical production. And we also have container closure system. The container that the pharmaceutical products are being manufactured is also an important aspect of stability testing. And some drugs are produced in liquid form, some drugs are produced in powder form, which you have to reconstitute to ingest the drug, and there's some drug that are in amber bottle. The drug are produced in different varieties depending on what work best for the drug, which will protect the drug from any further harm, any degradation, and it will expand the shelf life of the drug. And we also have storage condition. The storage condition that we store our pharmaceuticals are very, very important. There are some that should be put inside the in a cool environment. That's our suppositories and maybe an suppositories or the different suppositories and the like. And we also have that can be put in a normal shelf where of a certain temperature, certain degree to prevent the drug from any physical or any external factors. So for the starting of testing of new drug substance and products, ICH harmonization guideline cover the stability testing of new drug substance and products. Note that the light testing should be an integral part of stability testing. A systemic approach to photostability testing is recommended, covering an appropriate studies, which includes test on the drug substance, test on the exposed drug product, if necessary, and test on the drug product in immediate test on drug products in marketing pack. So the drug substance itself now. For drug substances, photostability testing should consist of 2 parts, which is the force degradation testing and confirmatory testing. The purpose of force degradation testing studies is to evaluate the overall photosensitivity of the materials for method development, purpose, and degradation pathway. This testing may involve the product substance alone and a simple solution suspension to validate the analytical procedure. In these studies, the sample should be in chemical inert and transparent containers. I've talked about that formally, that's why some drugs are packed in amber bottle and some are packed in the white containers. Sorry for the break in transmission. So the stability testing for new dosage form. The ICH analyzed on stability testing of new drug substance and products was issued on October 27, 1993. This document is an annex to ICH parent stability guideline and addresses the recommendation on what should be submitted regarding stability of new dosage forms by the owner of the original manufacturer. After the original submission of the new drug substance and product, then testing can follow. New dosage form. A new dosage form is defined as a drug product which is different from pharmaceutical product type but contains the same active substance as included in existing drug products approved by the government. Let's talking about, let me use the NAFDAC for example. Most of the, even 100% of the drugs that are being manufactured now are being tested by NAFDAC. That's why if they get your pharmacy or your store and there is no NAFDAC registration on a particular drug, you'll be held responsible for it. Why are you getting the drug without a NAFDAC registration number? The that's part of what the ICH guidelines is modeling to. The registration is very, very important because they will have to test the drug before it can be given to the consumers to start consuming it. They will test the drug, they will test the shelf, the ability to withstand physical and external forces and the likes. Bracketing and matrixing designs for stability testing of new dosage, substance and products. The study design is one in which samples of every combination of all design factors are tested at all time points. A reduced design is one in which samples of every factory combination is not all tested at all in time points. Any reduced design should have ability to adequately predict the retest period or shelf life. Application of reduced design. Reduced design can be applied to formal study of most types of drug products, although additional explanation should be provided for certain complex drug delivery systems where there are large numbers of potential drug device interaction. Whether bracketing or matrixing can be applied depending on the circumstances as discussed below. The use of any reduced design should be justified in certain cases. The condition described in this guideline is sufficient justification for use, while in other cases additional justification should be provided. The type and level of justification in each of these cases should depend on the availability of the product in use. So now to the bracketing. The design of stability schedule such that only samples at the extreme certain design factors, e.g. strength and packaging size, are tested at time points before the manufacturer continue. The design assumes that the stability of any intermediate level is represented by the stability of the extreme testing. Evaluation of stability data. The purpose of stability study is to establish, based on testing a minimum of drugs, substance or products, a retest period or shelf life and the best storage conditions are to be met. I've said that earlier on. Data should be presented in an appropriate format and evaluation of such data should be included in the manufacturing processes. Extrapolation is the practice of using a known data set to infer information about future data. Is to extend the retest period or shelf life of a product. Any extrapolation should be performed such that the extended period or shelf life will be valid for future use. I think I've said that another the other time. So now to the okay. I've talked about the ICH guideline for the stability testing itself. I've talked about the objective of the stability testing and the ICH guideline of stability testing. And now I've talked about the history of stability testing. And now to my conclusion. As the pharmaceutical industry growing day by day, there is a great need of developing guidelines, that will create harmonization. ICH is formed to develop and implement harmonized guidelines that will reduce the time required for registration of pharmaceutical products. The ICH guidelines are mainly categorized into four, which are quality, safety, efficacy, and multidisciplinary, which will cover almost all areas required for registration. So to round up everything I've said, the stability testing of our drug is very, very important. The father of medicine, which is Paracelsus, had a famous phrase which says, all substances are poison. There is none that is not a poison. Only the dose differentiates a poison from a remedy. The safety of our product is very, very important. That we poisonous substance or toxic substance, and where we are injecting the right dose or the right drug. So when you are getting your drug, check the manufacturing date before purchasing any pharmaceutical product for your own health benefit. Imagine you taking a drug that is expired for some months. It's only stomach that you are not seeing. By the time you get the drug goes to your esophagus, metabolize the liver, affect through the kidney via urine. It's not of harm, but that's what make your stability testing important. When you want to purchase any pharmaceutical product, the stability testing helps us to check for the manufacturing date, the expiring date product. Thank you.
All right, thank you very much. Thank you very much. Thank you very much for the presentation. Thank you very much for the presentation. About two presenters today, or three, they've been hammering on stability, stability, stability. Very, very important production. It's not just to manufacture dosage forms. Checking their stability is very, very important. The importance of this can never be overemphasized. And I don't know, I am proud of my students. They are giving it to me since today, back to back. And I feel like I don't know how to express how I feel. I thank you once more. Please, can we give another round of applause? Thank you very much. Okay, without wasting time, I want to go and come back again for the next presentation. Please do not think of moving an inch. If I don't leave,